Do you have red, itchy eyes and eyelids? They may be caused by allergies and allergens collecting on your eyelids. Since we're entering allergy season, this week's OCuTALK with Dr. Joseph Allen will be focusing on ocular allergies, what causes them, and what can be done to alleviate the irritation. Dr. Allen?
I want to talk to you.
Not now, later.
No, now.
Hello, everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us. He's the founder and host of his very own YouTube channel, Dr.'eyehealth, Dr. Joseph Allen. Dr. Allen, welcome back to OCuTALK.
Thank you so much. This is always such a great honor to be here with you guys, and thanks again.
Well, we're very excited to have you, and thank you again for joining us. I know you're very busy with everything that's going on, but I just wanted to kind of start off with I know you've done OCuTALK with us before, but for those of our audience who haven't seen you, can you kind of introduce yourself, your background, and your specialty?
Yeah, thank you. So I graduated from optometry school in San Antonio, Texas in 2015. Afterward, I completed a residency at the VA Medical Center here in Minneapolis, which was technically a primary care residency. However, in the VA setting, it's a lot of ocular disease. And since then, I've been primarily working in private practice settings, practicing primary care, a lot of ocular disease. I personally love anything on the front surface of the eye. So anterior segment, dry eyes, infections, inflammation, lots of different things that affect the eye. But I personally just love the eyes. And that's why I went on to starting my own YouTube channel. And I figured, you know what? I can talk about this all day long. Let's keep doing it. And that's kind of my short story.
Well, awesome. Again, thank you so much for joining us. And for those of you who haven't seen him yet, Dr.'eyehealth on YouTube. It's very, very informative, very, very fun. Well, Dr. Allen, since we're headed into allergy season, I kind of wanted to talk about eye allergies a little bit. And so can you explain to the audience what eye allergies are and how do they present themselves?
So right now you guys have like the perfect timing because it is the beginning of eye allergy season. Certainly the spring and fall are the biggest kind of irritant times for the eyes for most people, but I think the spring is even bigger deal than it is even in the fall. Allergies in general that affect every parts of the body. I think almost everybody's had probably some allergic response in their lifetime. For the eyes specifically, we usually think of it as itch. So the eye allergy complication is that you get itchy, watery eyes. That's usually what people experience with the eyes. But with so let me take a step back. So with allergies in general, there's antigens in our environment. That means that it could be something like dust, could be flower pollen. Something is in the air in our environment that our body recognizes as an antigen, is what we call it. And then you have an immune response to it. You have this allergy response where your body says, hey, this is a foreign thing. What's going on? Let's fight against it. And so your body produces what's called immunoglobulin or IgE that sends a signal to your body to release chemicals called histamines. And those histamines cause fluid to release from your blood vessels dilate, fluid starts to pool into your tissue, causes redness, pain, irritation. And especially for the eyes, we notice that as watery eyes, swollen eyelids, and the eyes itch. So that's kind of the itchy eyes in a breakdown.
Well, that's awesome. And thank you for that. Like I said, very informative, Dr. Allen, very informative. So what causes eye allergies? I know you talked about it, like maybe the environment, but could you go into it a little bit further about what causes eye allergies?
Yeah, so depending on the time of the year, so usually in the spring and fall, it's usually things outside. So the pollen, whether it's from tree or plants, dust is a common issue, especially in the wintertime, because most of us are indoors. So if I can recall my textbook from when I was a student, I think it's around 26, 28% of allergies in the winter are dust. And then 24% in the wintertime, surprisingly enough, is cockroaches. And I remember that because it was such a weird thing. And I was like, cockroaches, really? And I've had at least one patient before who they had an allergic response, a really severe one, to cockroaches where they were living in. But uh, outside of dust, bugs, and again, usually spores outside, that's most commonly the issue for the eyes. Things like, grass season. Down in Texas, where I used to live and went to school, they had what's called cedar fever. Uh, if you ever heard of that, but it's the cedar trees release their pollen, and you see cars are like almost a yellow color because of all the pollen in the air. Those are usually the biggest culprits. But you can have allergic responses to medications. People who wear eye makeup can have allergic responses to that. Uh, Basically, anything that you put on your skin can cause these issues.
Well, definitely, and us being here in Texas, we definitely see that yellow on the cars. So yeah, but we're for sure familiar with that. So, doctor, how do we know that what we have is eye allergies and it's not something else when our eyes are irritated during this time?
That's a really good but tough question. The So the challenge that every eye doctor faces when somebody comes in complaining, "Hey, my eyes itch," or "My eyes are in pain," "My eyes are swollen," is that then we have to kind of figure out, "Hey, what is the main cause? Could it just be allergies? Maybe it's something more. Maybe it's dry eyes." Uh, so the first most common symptom for true allergies of the eyes is the itch. So if you have dry eyes, usually it's more of a burning sensation, not quite an itchy where you need to scratch at it.
Right.
So usually if the eyes are puffy, watery, not like pus, not like a green mucus, that would be more like an infection. But if it's just a watery sensation and it itches, that's usually more of the symptom for allergy.
Gotcha. That makes sense now, definitely. So what would you recommend for anyone who's having these symptoms? Like, do you have like a recommended protocol that you like to go through?
Yeah, for depending on how severe the allergic response is. The first part that everybody can just do at home is simple. One, trying to avoid whatever is causing the allergy. You got to try to figure that out. And if you don't know what is causing it, you kind of have to do your own systematic approach. Now, some people know that, hey, in the springtime, they've always had this allergic response, and it's hard to get away from it. For myself, even last summer, or 2 summers ago, we moved into our house, and then I think I developed an allergy to something in the grass because every time my neighbor mows their grass, my eyes get all puffy and itchy. Uh, but so trying to avoid things is the big part. So if you know that you're having allergic response, you just started a new eye makeup or something, maybe try not to use that and see if you still develop this reaction. So you can try to systematically figure out, hey, what's causing it, and trying to avoid it is number one. The second part is using something like cold compresses if your eyes are really puffy and irritating. So using cold will soothe down the swelling, and that swelling is going to push on nerve endings, which cause a lot of the itchy and almost even pain for some people, depending how severe the swelling is. But cold can help with that. Afterwards, there are options, whether they are oral antihistamines that you can take as an oral pill. Some of those are available over the counter. You don't need a prescription for those. But if it's a severe reaction, then of course you talk to your family practitioner and see if they can help you with any recommendations for oral medications for antihistamines. Those do have some side effects, mainly that they dry the body out. So unfortunately, people who have eye allergies and they take oral medications, it can cause dry eyes. So that's something to keep in mind. But then there are also eye drops for antihistamines. Thankfully, a lot of the eye drops that have been out historically, even ones that used to be prescription only, are now becoming generic and over the counter. So we have, thankfully, a lot of different eye drops that are just over the counter for allergies. So I always encourage people to even try those out.
Always good to learn stuff from you, doctor. It's always fascinating listening to you. But is there anything else that you'd like to tell our audience before we leave here?
I think the biggest thing I always like to stress to people is you got to figure out what's causing it. If it's something that, again, like you're switched like eye makeup or something like that, or a new shampoo, conditioner in the bathroom, and all of a sudden you're having these flare ups, trying to just think about, hey, have I changed something new? Is it just the timing of the year? Is it stuff outside that you can't control, or is it something that you can? Because a lot of people, it's just, yeah, you switch to like a new shampoo or something like that, and that's causing the allergy. So eliminating the cause, eliminating that antigen is the best thing that you can do. So before even medications and things like that, that's like the best way.
Awesome. Well, Dr. Allen, thank you so much for joining us again. It was a pleasure talking with you. And to everyone out there, please go check out Dr. Allen's YouTube channel, Dr. EyeHealth. Very informative and very fun, like I said before. Dr. Allen, thank you so much for joining us.
Thank you so much. This has been fantastic.